Precision Neuromuscular Therapy has been teaching high-quality seminars across the country for over 20 years. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org. Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Visit massagebook.com, create an account, and transform your practice today. Don't wait. Give it a shot today.
Hi everyone, this is Whitney Lowe and welcome to the ABMP Podcast. Every massage therapist has encountered that one or maybe even dozens of client cases that feels like a puzzle with missing pieces. You follow the protocols and things you've been taught, but the client's progress stalls or maybe just doesn't even go anywhere. In this episode, I'll unpack the art and science of clinical reasoning, a systematic, creative approach to moving beyond the recipes and routines and confidently solving your most challenging client cases. We'll focus on a powerful framework for assessment and systematic-based mindset for uncovering the true source of your client's complaints and delivering outcomes that last. So let's do this by sort of taking a simulated client case to begin with. So picture this. Client walks in with a persistent shoulder pain. Maybe they've seen other practitioners. Maybe even you've worked on their rotator cuff and their shoulder muscles a little bit, their traps, their rhomboids. You followed the protocols that you've learned perfectly. But after a day or two of relief, the pain comes right back for them. It's frustrating for them, and honestly, it's frustrating for you too, because you start to wonder, like, what am I missing? Why isn't this working? That feeling of hitting a wall is something every therapist encounters. But what if I told you the answer really isn't a new technique? It's actually a new way of thinking. For over 30 years as a massage therapist and educator, I've been obsessed with that question. That question like, why isn't this working? How can I make it work better? What's going to be the most effective thing for my client? Today, we're going to pull back the curtain on a process called clinical reasoning, and we're going to move beyond the recipes and routines and learn how to become a real clinical detective capable of solving your most puzzling client cases with confidence. So let's start by talking about protocols and sort of routines that we learn. There's a reason that we learn massage in these different routines. First of all, it sort of systematizes the information and the skills that we're learning so that it's not just an overwhelming mass of things. Let's say you're going to work on the shoulder area. You may be given a routine of a series of different techniques for working on that particular area. That series is important because it helps you structure and organize the skills that you're learning in that particular region. So these routines are protocols that give us a clear starting point and a sense of safety, especially when we're early in our careers. But the problem is that if we focus on that protocol and you don't get outside of that protocol, eventually, then you sort of become a protocol-only mindset, assuming that every client with similar symptoms is going to be the same, and you just treat it, let's say, with the shoulder routine that you learned, or the shoulder methods, or the shoulder techniques. Some of those things might be helpful, but sometimes some of those techniques are going to be detrimental or just basically ineffective. So this leads you to kind of treating a group of symptoms, not necessarily the person or the actual unique problem that that person has brought to you. There are some common traps that we fall into when a person comes in with a pain and injury complaint, and we want to, clearly our interest is wanting to help them as much as possible. So here are some things that we can kind of get off track on. First of all, it's just chasing the pain itself, focusing solely or exclusively on the area that hurts. Now, that may be beneficial in certain instances. Again, this is why assessment is so important, because where it hurts might be the source of the problem. There may be some specific tissue dysfunction or damage in that particular area. But oftentimes, where it hurts is not really where the primary problem is, because that might be ignoring the kinetic chain and the biomechanical influences from other parts of the body, referred pain, or the fact that, for example, nerves that might be pinched near the spine, like in the cervical or lumbar region, might be producing pain in a distal extremity. So treating that particular distal location might not really be the source of what you need to be focusing on. Another problem is the confirmation bias rut. So maybe we have a favorite theory for what causes shoulder pain, like it's always the subscapularis, or it's always the supraspinatus, or I need to work on the posterior rotator cuff group. So we'll look for evidence that supports that particular theory that we have. This is called a confirmation bias. Sometimes you might be right, but a lot of times you might find that what you're doing is giving you some information that's not necessarily accurate, and you're trying to squeeze everything into that particular picture. Another problem that we face is a fear of the unknown. So when a case is complex or there's something there that we may not be familiar with, it's easy to feel what we often refer to as the imposter syndrome of like, I don't know what I'm doing. I haven't learned anything about this. I'm no good, or whatever it is that you might be saying to yourself. This fear can cause us to retreat into the simplest explanations, or maybe try to, again, lean back on our confirmation bias and go back to those things that we do know about, even if it doesn't really fit the client's unique story or what they're telling you. So what we really want to learn to do is to break free from these traps that require a shift. It requires a different way of looking at things. It's about moving from being a technician who just follows a recipe or a routine to becoming a creative clinician who really creates a customized plan that's ideal for that particular client at this particular point in time. Because remember, something might be ideal for this client right now, or maybe it's not ideal right now, but it will be at a later point. Or maybe something that's working now is not going to be so effective later on. That's because you have to have some degree of flexibility in your approach and recognize not everything is going to be treated exactly the same all the time. So let's look at this clinical reasoning idea, the idea that a reasoning process, and again, this is more of a cognitive or thinking process more than it is just a technique. And here's one of the reasons this is so important is a lot of the practitioners, in fact, most of us who have spent a lot of time treating pain and injury conditions, had to learn that information or learn those skills and abilities through continuing education courses, because this is not necessarily covered in great detail in our entry-level training. The problem is so many continuing education courses focus predominantly on techniques and methods. We teach lots of things to do with our hands and lots of different strategies or ways to manipulate tissue, but there's not as much emphasis on that entire clinical reasoning process, and sometimes that's a whole lot more important. So here's some things that we can focus on to really strengthen those clinical reasoning muscles. First of all, it isn't magic. It's really a systematic process of inquiry. So I like to break it down into these sort of key steps here. Hypothesize, investigate, interpret, and then intervene. So let's start with each one of those individual 4 steps. First is to hypothesize. This is the art of your educated guess. And, we say it's an educated guess. That's because sometimes we may never know exactly what is going on, but it's like being a detective. You're going to look for as many individual clues as you can that will point you in a direction that seems to have the greatest degree of accuracy. So the most important place that we start here is with the client's story. Taking a comprehensive history is critically important. You've got to listen to what the client says in detail and pick up on key pieces of information from the client that might point you in the direction of where you're going to take the rest of your assessment and evaluation, investigation process, and then eventually interpreting and making a determination for how you're going to intervene. So, for example, you might think to yourself, hey, with this particular client, based on their desk job and where their pain is located and what they're reporting, my kind of initial hypothesis, this could be maybe something coming from the cervical spine that's referring pain. Maybe it's like a nerve compression problem like thoracic outlet syndrome, or maybe there's some muscular involvement, serratus anterior muscle causing some problems that are happening there in the shoulder region. This is going to come because we put together key pieces of information from the assessment and evaluation process that's going to eventually make sense. So this strategy highlights the importance of knowing some key clinical characteristics of many of the common soft tissue disorders. Again, most of our CE programs focus on a lot of techniques and focusing on a lot of methodologies, but it's really important that you learn about a variety of different soft tissue disorders that are likely to occur, because then you know what kind of questions to ask. You know what some of the key red flags or yellow flags that come up when a person says something, you're thinking, that sounds a lot like, so-and-so type of problem or so-and-so condition. Now I'm going to investigate that further. So this becomes a critical part of your clinical reasoning process. Now the second step, or the second part, is the investigation part. This is where the assessment is so critically important. So remember that assessment isn't about doing like every single test that you can think of that you look up in an orthopedic book or something like that. It's about a systematic process of gathering information that's going to help you confirm or deny your hypothesis. So let's say in the shoulder region, for example, you don't have to do every single range of motion test that's necessary in the shoulder. You're going to pick and choose ones that are going to be specific for either confirming or denying your hypothesis of what's really going on there. So you might say, for example, in this shoulder pain that we were talking about, I want to test this hypothesis. I want to start with some active range of motion in the neck and shoulder region. We're going to have our client turn their head in certain directions and move their shoulder in certain directions and see if it reproduces or changes that pain at all. Maybe it makes it better. Sometimes a particular motion will relieve pain, and that can tell us something about what's mechanically being de-stressed in that particular movement. Critical information that we may pull up and be able to use that more effectively. So you may also use, various different types of testing procedures. Common orthopedic tests are like palpation is a very critical and highly effective evaluation tool in your assessment process. So everything that you have at your fingertips, knowledge about how to use these different physical examination methods as you're looking at this, and this includes, the observation and the palpation things that you're doing. All of those will be critical for putting together a comprehensive hypothesis or idea about what you think is really going on. Next comes the more challenging part. This is the interpretation. One of the things that I have found over, decades of teaching assessment and evaluation processes to practitioners all across the country is lots of people say they were taught in school how to perform range of motion activities as a part of an evaluation process. What they weren't really taught was how to interpret the results of those tests and what do they really mean. So like if a client's got pain with, an active flexion and passive flexion, but not with resisted flexion, what does that pattern mean? This is where the interpretation comes in. And it's, again, very important for you to understand some of the biomechanics and kinesiology of some of these different structures and regions of the body and what happens in different motions, different positions, and different types of testing procedures to make an accurate interpretation of what those results are going to tell you. Because it's not good enough to just run through the test and say, okay, if it doesn't hurt, then I can just ignore it. If this hurts, then I'll pay attention to that. No, we're looking for patterns. We're looking for pattern recognition of things that will help us interpret and connect the dots for what those things really mean as you put them all together. And then finally, step 4 is your intervention, your strategic treatment plan. So this comes after you've gotten a hypothesis, tested that hypothesis, and now you have an idea of what the nature of this problem is and what's going to be the most effective way to address that. And this is where we'll come up with our intervention. So instead of just, applying everything that you know how to do to the shoulder, now you're going to focus on maybe this particular group of cervical muscles, this group of shoulder muscles, and I'm going to do some superficial, gentle neural mobilization techniques or something, or maybe neuroclinical sort of dermoneuromodulation or myofascial work or whatever your methodology is for settling down the nervous system. I'm going to do this first, and then I'm going to target these specific tissues with small localized pressure because I think there's something going on with this person's levator scapula, or I think there's something going on with their scalene muscles, or this thing seems to be happening here with their rotator cuff muscles. Now you're going to take the methodology. This is where your techniques that you have learned are going to be super helpful because now you know not just what to do, but when and why to do them much more effectively. And I promise you, this is going to make your work so much more effective. It's critical to remember that this kind of framework really requires you look at the body as an interconnected system. So the shoulder pain might be, it's kind of like a check engine light. Like that's where the thing is showing up, but there might be something else going on, maybe in the cervical region, somewhere else that's really causing that thing to happen again. So you're following this chain of events and exploring things in a comprehensive and strategic way to get an idea what is really going to be the nature of that problem. So let's see if we can put these concepts into practice with a simulated case study process for just a moment. Let's go back to that client who said that had some shoulder pain, and we'll call her Jane. Let's say, and Jane is a 45-year-old graphic designer, and she's got right-sided shoulder pain and arm pain she's had for maybe about 6 months or so. She may have done some massage work before and said that previous massage gave her temporary relief, but it never really lasted for long. You want to do something more effective with her, try to find a good relief for her. So where do we start with this hypothesis? So when she talked to us, she said the pain is deep and it's a deep aching in her deltoid muscle, but sometimes she gets tingling in her hands, especially after working on the computer for long hours. She also mentions occasional neck stiffness associated with that. Now, a couple of things just in that little bit of information that we found out. When she said that she has tingling in her hands, that's a big flag. That's a key point that we want to zero in on because this is almost always an indicator of neurological involvement. So this is now going to narrow down the focus of my hypothesis into possible something like a cervical radiculopathy where there's maybe a cervical nerve root involved that's getting pinched. It could be a thoracic outlet syndrome, compression of the brachial plexus in that thoracic outlet region, or maybe even a more distal peripheral type of nerve entrapment farther down the arm. We're going to want to investigate all of those with more specific applications of our assessment to see if we can either reproduce or change or eliminate that pain and give us a good idea of where this is happening. So now that group of signs and symptoms tells us that I don't think, for example, this is a rotator cuff tear. This is not really on the top of my list any longer, even though I was focusing some and thinking about the rotator cuff muscles in the shoulder. This is now sort of sending me in a different direction. Now, if you've taken a comprehensive history with any of your clients, you know frequently that people may have more than one thing going on. So we won't necessarily throw that out completely if there's something in there that would indicate, hey, that still might be an issue, but we want to try to separate those things and determine what is part of what different thing going on that we want to focus on. Now, when we get to the investigative part, I'm going to watch Jane move in various different motions as I have her do some range of motion things, turning her head, moving her shoulder into different positions, and see if there's anything that reproduces the pain with the pattern of movements, of active movements, passive movements, and possibly even resisted isometric testing. We may also do some special orthopedic tests, like something called the Sperling's test, where I press down on the top of her head and see if this reproduces neurological sensations, because that often does so if there's a cervical nerve root involvement there. Then I'll check some other things for those other pieces of my hypothesis, some of those procedures or methods that are more likely to reproduce symptoms if something like thoracic outlet syndrome is present. Or I'll do some neurodynamic testing that would maybe give me some more evidence about something like a more peripheral nerve entrapment farther down the upper extremity. These are now going to be additional pieces that I'm going to use to get more accurate information to put together in that hypothesis and get a good understanding of what I think is happening. So now we're at that interpretation stage. So based on that information that we're getting from those different tests, it's looking again like this is something much more of a cervical issue than it is a shoulder joint issue. And so my focus now also is going to zero in on some of the more specific things that I found as a result, maybe with the Sperling test or the neck movements, indicating that there is more of a cervical nerve root issue or something that's going on there. Now, there's a lot of soft tissue work that I still may do in that area, but it's going to also give me some important precautions and red flags about what kind of work I'm going to do so I don't aggravate that nerve root problem and make it any worse. So now we'll jump to the fourth stage, the intervening process. So now I'm going to construct my treatment plan for her, and I'm going to be focused predominantly on the neck and cervical region, of course, because that's where it seems like the root of this particular problem is. I'm going to work from a muscular standpoint on things like the scalenes, the levator scapula, the posterior cervical muscles that might be aiding in some of that neural compression as well. So now I'm going to focus with my specific massage techniques on those things that I think are going to be the most beneficial in helping to reduce the nature of the symptoms that she was experiencing. In addition, this is also going to direct some of my home care suggestions to her to give her ideas of what kind of things she can do at home to help support what we've done with the work here and make it much more effective. So now, afterwards, the outcome from this session focused on her neck. She's going to report significant reduction in her pain that was much more long-lasting because I've done something that was much more effective in addressing the primary root of the problem instead of just sort of chasing around where it looked like the symptoms were manifesting throughout her body. So what we see here is the clinical reasoning process. We want to go through those different processes of hypothesizing, investigating, interpreting, and then choosing an appropriate intervention with our treatment plan. You have to get curious for this clinical reasoning process to really work. It's a combination of curiosity, investigation, testing, retesting, and always questioning yourself. Remember, you are not going to know everything that there is to know about treating every kind of condition that's going to walk into your treatment room. You're just not. But you can do a very good job of being as effective as possible and learn from each one of them. And then the next time something happens, hey, you've learned from that because I remember this happened once before and I learned something. What I really want you to do, you've probably learned a lot of the what to do in many of your different techniques. I want you to fall in love with the why. Why are you doing what you're doing? So next time that you're working on somebody who's got a pain complaint or something that you're really trying to zero in on, focusing on what you're doing with your hands and ask, why am I doing this? Why am I doing this particular technique? What's the rationale or reason that I'm doing this particular strategy, and how is it most going to benefit that client? That's really going to help you strengthen those clinical reasoning muscles and go through that process and get much more effective thoughts. So remember, becoming a clinical detective is really a journey. It's not a destination. It's a constant process. And it's the most rewarding, I think anyway, the most rewarding part of our work. I love the idea that we can go to work each day and change someone's life and take them out of pain simply by what we do with our hands and the way that we interact with them. So much power in that of what we do. So it's what really elevates our profession into the wonderful occupation and the sort of life practice that it has become for so many of us. So we're going to become much more than somebody who's just delivering a service to becoming a true healthcare solution for your clients. So if this way of thinking really resonates with you and you want to dive deeper into building these skills, look into this whole idea of clinical reasoning processes. And as you're doing some of your educational strategies and looking at courses that you might take and things like that, ask about what is the sort of clinical reasoning process that's going to come out of that. If I take this course, what kind of things am I going to learn that are going to help me in that reasoning process be more effective? More than just, learning some new techniques and some new things to do with my hands. Those things are always important, but there's so much more to it when it comes to being a comprehensive and thorough healthcare professional that's going to help so many more people get out of pain. And this is just such a wonderful part of what we do. So let's keep exploring that process. I'll look forward to sharing some more ideas with you on your clinical reasoning process the next time. If you got any questions or you want to share some thoughts or ideas about the whole idea of clinical reasoning, please feel free to drop me a note on email, whitney@academyofclinicalmassage.com. Love to hear some more about your clinical reasoning journey and how you found that effective as well. We'll see you next time. Thanks again for joining us on the ABMP Podcast.
Anatomy Trains invites you to take your career to the next level with Anatomy Trains Structural Integration, ATSI. We're kicking off the next training this September in Maine under the guidance of Tom Myers and our expert team. Come map the pattern and shape the change in this transformational 3-part certification program. Visit anatomytrains.com for details.